Hi, everyone. My name is Matthew Martin. I'm a physical therapist at LSU Health Shreveport School of Allied Health Professions. And I'd like to talk with you all today about my poster that's entitled The Use of Blood Flow Restriction Training Following Incomplete Spinal Cord Injury, and it is a case report. So just by way of background, as most of us know, the benefits of blood flow restriction training are detailed in both healthy and orthopedic populations. But there is definitely a lacking in the research area for the addition of this modality to individuals with neurologic impairment. And more specifically, there is very little research regarding the effects of blood flow restriction training in individuals with spinal cord injury. So the purpose of this case report is really just to present a case where the use of blood flow restriction training was applied to an individual with incomplete spinal cord injury. So the client was a 54-year-old male, and he presented to our outpatient PT clinic about 1 month following resection of a T3 to T9 ependymoma. And that actually resulted in his incomplete spinal cord injury, the resection of the tumor. And upon his presentation to the clinic, his chief complaints were an inability to stand and walk independently. And during his physical examination, it was revealed that he had absent light touch sensation below the level of the T6 and diminished proprioception in bilateral lower extremities, as well as gross weakness in bilateral lower extremities. So prior to initiating blood flow restriction training, the patient participated in traditional neurorehab PT interventions. That included transfer training, sit-to-stand training, static standing balance training, and then we had also initiated some gait training via body weight supported treadmill training, with an eventual progression to some very short distance overground gait training with lots of physical assistance. So for about 6 months, we had been doing those interventions, and then we decided to try this modality. And so we screened the patient for any absolute contraindications to the use of blood flow restriction, and he had none. And so we initiated the use of this modality for this client. So for a 1 month period and 2 sessions a week for 1 month, and he had a total of 7 sessions, we did blood flow restriction training. And those sessions involved both strengthening exercises and aerobic training exercises. So in terms of strengthening, the patient did isometric gluteal, hamstring, and quadriceps contractions, as well as supine dorsiflexion repetitions. And the set repetition scheme that was used was a set of 30 followed by 3 sets of 15 of those exercises. And then the sessions also involved aerobic training, and that included anywhere from 10 to 15 minutes of activity on a recumbent stepper with a goal of maintaining greater than or equal to 14 on the Borg perceived exertion scale. And so during both of these activities, both the strengthening and the aerobic training, bilateral blood flow restriction was applied to the lower extremities. And you can see here that we used several different outcome measures, both subjective and objective, to document his progress. We looked at the activity-specific balance confidence scale, which is a self-report measure of balance confidence, the timed up and go to measure his functional mobility, the 6-minute walk test for general activity tolerance, the 10-meter walk test, again, a measure of gait speed and functional mobility, the walking index for spinal cord injury, which is an assessment of the amount of assistance that is required and adaptive equipment required for individuals with spinal cord injury to walk, and then the World Health Organization Quality of Life Questionnaire. And so any of these outcome measures where you see an asterisk is actually, those are the outcome measures where we saw significant improvement, so at or beyond minimum detectable change scores. So as you can see for the timed up and go, which assesses again his functional mobility, there was a significant improvement there, as well as his activity tolerance in the 6-minute walk test. We also saw a very significant improvement in his independence with walking and need for different adaptive devices with walking per the walking index for spinal cord injury. And then the physical and social subscales of the World Health Organization quality of life measure also improved significantly. So in conclusion, statistically significant improvements were noted in functional mobility, activity tolerance, walking independence, and physical and social quality of life after the initiation of blood flow restriction training. And then additional, although not significant improvements were also noted in balance confidence and gait speed. So this case report really describes the safe and effective application of blood flow restriction training in an individual with incomplete spinal cord injury. However, further research is definitely warranted to support the efficacy of these interventions and to apply this modality to more individuals with incomplete spinal cord injury, and then more broadly to more individuals with neurologic impairment. Thank you so much.